I would like to introduce a very highly appreciated and prestigious colleague of us, Dr. Simona Cueves. She is in San Antonio, Texas. And besides sharing the love for dentistry, we share 3 languages which we really mix up when we talk with each other. And of course, the passion for dentistry. It is a pleasure to have you on board, Simona, and I would like to now give you the honor and to open the webinar, and please also be kind and introduce yourself with a couple of words. Thank you.
Perfect. Hi, everybody. Thank you so much for joining. And Dr. Steyer, thank you very much for including me in this panel of prestigious and amazing doctors that you are choosing to interview. A little bit about myself. I graduated from dental school in 1995 from the University of Texas Health Science Center in San Antonio. And I have been practicing dentistry ever since. I'm a so-called wet-handed dentist. So I feel I have the hand on the pulse of today's dentistry in the United States. And I have been intermittently teaching since ever I graduated at the University of Texas Health Science Center, either in the Department of Aesthetics or Comprehensive Dentistry as an associate professor. I published and wrote numerous articles, have lectured nationally and internationally on aesthetic dentistry. And I have also loved giving hands-on training courses because my passion comes from a background of art. So the incorporation of art into science, I think, is what we do best. And I really enjoy that. And I am considered a key opinion leader by many of the modern dental manufacturers, and have the chance to evaluate new products and give my opinion, my 2 cents, so to speak, on what I think of the certain new inventions or products that come to market. And with friends like Dr. Steyer, I feel like my back is covered because in the position that I'm in, I can always pick up the phone and call somebody that smart and that knowledgeable who can actually give me an honest opinion, which often shapes the way I feel about some products. That being said, today I feel like I was invited here to speak about the Reveal loops, the headlight loop system, which I was lucky enough to be able to use for a while now, and I can honestly say have changed the way I practice dentistry. Absolutely.
Thank you.
I am embarrassed to say that I thought I was seeing things and being a good diagnostician and practitioner before Reveal loops, because once I put those glasses on, the world changed for me. And I was now seeing that what I had learned in microbiology about, and that what I had learned in all the other sciences that we incorporate in dentistry, and being able to see, you know how the English expression goes, seeing is believing. I think this is what we're talking about here.
Thank you. I highly appreciate the words go probably in big part to Designs for Vision, who supported this and who made it happen.
And had an open mind.
Yes.
Because unfortunately, so many good ideas sometimes get lost.
Yeah.
You know, so the stubbornness of manufacturers to include them and incorporate them.
Can you show us your the Reveal, please, and explain us?
I brought mine.
Okay, fabulous.
Absolutely.
Can you switch it
I
also
brought them
on?
here. Let me turn the light on. Absolutely.
And explain it, how you use it, give us your feedback, what everything you
Well,
have to say about.
in a small preparation for this lecture, what I actually did is made a small PowerPoint presentation that I kind of delineated all the points that I feel are important to incorporate when we discuss a new product. And if you don't mind, with your permission, I would like to share the screen and then maybe let it guide us a little bit into,
Please.
so we don't forget anything, because there's so many amazing points I would like to cover.
Please, if we can do a second round.
Well, this is, and I don't want this to be misunderstood for to be a lecture, because it's truly more an informational discussion about what these glasses mean to me.
Yes.
It's my personal opinion, and I would like to add here that I have not received any compensation, or planning on for that matter, but from the inventors or the manufacturers, and this is purely my personal belief in the quality of this product, and I feel that it's important that we share it with our colleagues so they too can see the difference that I have witnessed by using them. So let's start a little bit by showing the light frame. These are special coated glasses. They come in a magnification. They make them to your prescription and then have a magnification of 2.5. And then here's the light.
You shared.
And then
it's
a UV light of 4 or 5 nanometers. If I.
Simona, you shared
Yes.
the screen, and we do not see.
Oh, you don't see me. Okay.
Please.
Let me stop sharing for a second. Okay, I'm new at this Zoom thing, so please forgive me. Okay, here you go. And this is the filter. They're special filters. Can you see it closer to my face, I think, with the background? Can you see it? Is it visible?
Yes.
Okay. And the patient and the assistant wear special glasses to protect their eyes. These lenses are coated, so are the magnifiers, the loops. And I believe that the batteries last a very long time. I can use the batteries, sometimes my assistant forgets to charge them, and several days I get out of one battery pack. So it's perfect. Also, they're very easily cleansable and very light. And what's amazing about them compared to my previous loops, they do not fall off your face. So they're light enough, and with the headband system that holds in the back of your head, they actually stay put. So we discussed that. And the light, it's a high intensity UV light at 405 nanometers. And special, I'm sure, secret filters. Secret filters to what makes us able to see. So what I have gone here by putting this together, I assume that most people who are watching this do not have a pair of these glasses. And what's important is to show to them not only how they work and what we see through them, but what the terminology means and how we actually have come to calling what fluorescence enhanced theragnosis, what it means, especially if we go across languages and the translation might mean different things to different people. So to me, that's most important to go over that. And then I would like to continue by talking, which I think should take up the longest part of this discussion, is how it helps us see dentistry better.
Please do so. Thank you so much.
Can I forward this, please? The next slide. There we go. Okay. Told you I'm new at this. Next time I know I'll be better. Okay. It offers fluorescent light, tissue excitation under magnification. It allows the practitioner to surpass the standard classic modalities of diagnosis. So what does that mean really to us? We all are, I believe, every dentist, even if they're not, they believe themselves to be very good diagnosticians. So we know that we all have big egos and it's hard to get past that. So what we have with the Reveal system is realizing ourselves when we're by ourselves in our own mind that we can see now so much better. And we can be so much better than we were before, regardless the level we were at before. This puts everybody, catapults everybody to a different level. And I think that is what sets these loops apart from everything else on the market. We still want to use the same diagnostic standards as checking intraoral, extraoral examination, probing, radiographs, and photos. All those are not excluded when diagnosing with the Reveal system. But I think that being able to incorporate this into your everyday practice will change the way you see things and will change, the old idea of caries sticking. There's many dentists out there that I know that if they probe a black spot and if it doesn't stick to the probe, they don't consider it caries, they call it stain. Now we know that is false, and Reveal is the best example. You let them use these glasses and they see the porphyrin's luminous back from the bacteria that infiltrated that enamel, and you don't have to explain anymore. Now, what I think it's important for those at home who aren't very clear on what fluorescence really is and what we mean when we say fluorescent and the form of luminescent that it is, and the way the light is absorbed and sent back to us to see what that means and what diagnosis is. The combination of the diagnostic tests that we have, right, with the treatment. So I think that's a very clever word that says a lot. Now, why do we use theragnosis? Why do we use fluorescence? It's to enhance our theragnosis. In other words, to enhance our diagnosis and to enhance our treatment. Now, the question is, how do we do that? Okay, the Reveal light, we went over that, already emits what it emits, a high energy UV light. This is more for somebody who wants to get a better idea of what it is, and then of course reach back to you or the manufacturer and get actually scientific details. Like I said, this is just informational. I have not included any pictures, slides, or data from any studies in this because we'll leave that for an actual lecture. This is just to kind of open the mind up, in my opinion. And please stop me at any time and add, because like I said, I just did a quick 1, 2, 3 in my head, what's most important and what would I like the other doctors to know about these glasses, and wanted to start with the basics. Lexus, I lost it. Oh, here it is. Okay, the 2 magnification, we talked about the loops, 2.5. And I think, Dr. Steyer, they can have them at a higher magnification as well, correct? So if some doctors are used to having a higher magnifications in their loop, 2.5 being the standard, they can request it when they order glasses. Am I correct in that?
Yes, you are correct. It can even go into not only into a higher magnification, it can also go into this wide field. All is possible, but
and all it costs is money.
So, yes. No, it's not about money, it's about preference.
Okay.
No, it's about preferences, personal preferences.
Yeah, no, they don't charge different for making anything special for you.
Personal preferences, yes.
Correct.
You're right.
And I must say they're at a very, very reasonable point price point compared to everything else that's on the market. Another thing that we have not touched on is the fact that it's the first piece of equipment that is hands-free in the fluorescence space. So not only do we get loops that magnify for us to see very well inside the oral cavity, but we have fluorescence, which so far we would do with a veloscope or other kind of pieces of equipment that you needed an assistant or somebody else to hold the cheek while you're working, shining the light. This is all included by having it on your head, and to me that's amazing. Not to have to take up, you only have two hands, so dentistry is hard enough as is. Trying to go in and illuminate something is even harder. So my take on the reveal glasses, I thought of it would be, if I had to use just one sentence, I would say it's theragnosis on steroids. Because it's nice. It's nice really, it's amazing. It's I was telling a student the other day at the university, they asked me, what do I feel? What do I see through these glasses? And I said, imagine when you see a butterfly on a flower, how beautiful it looks. Putting the glasses on now, you see the parasites that are on those wings. And the damage they cause on the butterfly. So that's the difference, truly.
Very nice. Thank you.
And then now what's most important, I think, for every doctor who is thinking about maybe investing in this product is what they can actually expect when they put those glasses on. And I always encourage people to probably go to their rep, ask their rep if they have one locally, to go and show them, because nothing beats seeing with your own eyes. That to me was the changing, the paradigm shift. Where do I want, what loops do I want? I'm looking at prices, I'm looking at lightness, I'm looking at other things, but what makes the difference? Why would I want to invest in these with this light on it, this special light? What makes the difference? What do I see? And first off, fluorescence, you see the difference of, you see different colors. Everything luminesces back differently. So you will see healthy enamel in the green. You go from a range, I believe, from white all the way to brown. And the orange and the reds being particularly bright, as well as the greens. Now, we see dentin, luminesces different than enamel. Demineralized tissue, enamel, which we could not see before. You assume, is it a white spot lesion? What is it when you look at something past ortho, after ortho, post ortho? Is it really just decalcification? Is there bacterial infiltrate in that decalcification? Do you need to address it? Or do you just put fluoride or whatever other kind of treatment you would like on it? Those are all things that go through our mind every day. And being, like I said, that I work full time and I see patients every day. My practice is a general dentistry practice with emphasis on aesthetic dentistry. That being said, I'm sorry, Dr. Steyer, but I do not do root canals. And I do limited extractions, but I do a lot of restorative and perio. So that right here, let me go to the next slide. And that will go more, we're starting, I would say, let's start extraorally and go intraorally. Okay. Putting your glasses on extraorally, what are we looking for? Easy for me to see, I was surprised to see angular cheilitis, beginning angular cheilitis, which is, in our climate, it's a problem. People come with fungal infections that they have been trying to nurse for years and never know what to do about it and what it is. And every time they tell me that instead of doing an antifungal, their doctor told them to do an antimicrobial agent, like a Neosporin type. And by putting the lights on and seeing, it's not just bacteria, but you can see the difference in color. You can actually start, I'm not a physician, so I'm not going to go and diagnose exactly what it is in terms of on a microbiological level, but I can either send them to something over the counter, to take over the counter and get them back in 2 weeks. And I have done that on several patients and it cleared. So that's perfect. And that's thanks to Reveal, because sometimes those starting angular cheilitis problems, you can't see with naked eye. So that is the problem. That's the benefit extraorally. Then you open the mouth intraorally. What I have diagnosed is a lot of candidiasis, not just in adults, but in children. And one patient in particular, a denture patient, had candidiasis in the back of her throat, nowhere in the mouth or on the lips. Mm-hmm. So by shining the light in her mouth, I was able to see how back in her throat it was and sent her to her physician. Also was able to see what was on her denture when she took it out, that was an infected surface that had to be sterilized. Mm-hmm. So then when we go, also cancer, very important thing, cancer. When collagen fibers get destroyed, you have a lack of them in cancer cells, in cancer tissue. So by putting the light, the fluorescent light on it, what happens is it doesn't shine back at you anymore. So you see basically a brown spot. And something that you would not pay attention to before, now you're looking at the palate or at the tongue and you see this brown, irregular bordered area. And I have to say that I've had 2 patients already since using that were confirmed with squamous cell carcinoma after I sent them for biopsy, and they had absolutely no indication of oral cancer or symptoms prior to me looking with a Reveal light to them. So if nothing else in convincing, that alone, saving the health of those 2 patients is worth getting the glasses. We discussed enamel. You can see healthy enamel carriers, the mineralized enamel, dentin. Many students, and I know dentists, practicing dentists as well, have a hard time discerning between enamel and dentin. Mm-hmm. When they prep, they still can't figure out, they can't see the difference. Well, with Reveal, it's very clear. So that in the restorative process, that takes that step, that worry away. Caries, which is the biggest thing. We see the porphyrins luminate from the bacteria that cause not only decay like strep mutans, but also the bacteria in calculus and in tissue that cause infection in the periodontal tissues. So then we can see mature biofilm and calculus deposits. They shine up orange, and I believe that those listening can look back into your files and see the pictures, beautiful pictures you have shared with all of us showing the calculus. And the way I would like to describe that, it's not the calculus that we all see, oh yeah, it's a chunk of white stuff, yeah, and hard. We all know that's calculus. It's like when you have a stainless steel sink and you think you cleaned it, but you run your finger over it and it's still rough. That hard deposit, that regular cleaning will not take off. The same in the mouth. It's what's important to see. It's that hard deposit, not the chunks. The chunks we can see and we've been able to see without. It's that hard deposit that hygienists almost always leave behind. That is what's important to see and to remove. And you have a whole bunch of different modalities that you like, to microabrasion, a lot of things to remove that. I try to follow those as well, but I think that's for a different discussion
Yeah.
as to how we approach that. Then what else I found to be amazing is perimplantitis. That's part with the bacteria that you see, and you can tell when an implant is failing and why, and you see bright red, and then you're not surprised that 2 weeks later it falls out. That's kind of common. Dental materials, they all luminesce differently. So what I usually find extremely hard is removing an old crown or an old veneer, layered porcelain that was bonded very well, and it still is, and due to a crack or discoloration, or just in my field in aesthetic dentistry, people just want whiter teeth and we need to remove the old veneers. It's been so hard prior to reveal to see that interface, because now I don't want to damage the patient when I redo the work and remove more enamel or dentin, depending where they're at. And it's very hard to grind when you're in the process of grinding it off to see that difference. With reveal, it's like you're doing color mapping, you're grinding the different color off, and it's great. Also, I see a lot of patients that just completed full ortho and not only have scratches on the enamel, but have composite left. Some is obvious for all of us. You can see it and you can try and scrape it, polish it, etc. But it's the film, the bonding that was left when they did the adhesion process to the enamel of the bracket that many people carry with them for the rest of their life. So being able to see that is amazing, and being able to clean it properly without removing enamel. Also in Invisalign cases. Now I know you don't like Invisalign, and I'm gonna refrain from making a decision being that I'm Invisalign as we speak, personally. But those buttons that we are gluing on the patients to facilitate movement, we try to put in composite colors that match the enamel exactly. So when they don't wear them, they're not so obvious. Taking them off is another story, because you get such a good composite match, and composites nowadays are really beautiful and they match really good. They have a good chromatogenic effect, and they're just very colored. You can find them great. And now even another company just is coming out this month with a composite that has so many light emitting particles incorporated in it that it actually can match, one shade can match 6 composite shades, 6 teeth shades on the Vita scale. So that's quite amazing. That being said, it's hard to remove it when you match it well, and to know the difference when you're in enamel, when you're in composite. It's not a question when you have the reveal. It's just they luminesce differently, different color. You grind them off. Cracks in teeth. Those are, again, how many times have you been able to actually see a crack that you could fix with endo? We're not talking a crack when the tooth separated in two. We can see that. You just move it and it just comes apart. But the cracks that the patient continues to come back with sensitivity, post-op sensitivity, and all sorts of other issues on biting and you don't know why.
Allow me please to
Yes, please.
ask you here about your personal experience. Have you managed in the meantime to, once you cleaned and you have that crack exposed?
Seal. Oh, exposed, yes.
Have you looked up and could you identify in that crack, in that fracture line? Could you ever
Bacterial.
identify Yes, could you identify
Yes,
that orange?
yes,
Okay.
yes,
This is exactly,
absolutely.
this is exactly what I think, and in my world, would take us to a different level if we manage to simply disinfect in that area.
That's
And
what I
then
do.
going back to Professor Belli's Belli's and mine original ideas, simply go and, you know, when you have a rug in the, in your living room, you do not go and you do not put your foot on the you put it on the rug, so the pressure is not coming into the crack, and the crack, due to fractology, science of fractology, the crack will not propagate further, but it will be on the forces will be placed. I published, I do not remember, did we publish together, Sema? I do not even remember. I believe we published it together. You would divert the forces. So you disinfect first and then you reinforce, and you do not need a root canal. And yes, I am an endodontist, but the best root canal I have ever done is the one which I did not.
Correct, correct. That's the only way to save a tooth. I agree. No, I agree 100%. I did see that. My treatment so far, and I'm sorry, I have not read your article as of yet, but I will search it out, is opening up the crack after identifying it, which identification is a big thing because I'm not going to chase every craze line in a tooth. As we know, there's so many craze lines that lead to nothing. But then you put the reveal on and you see an actual, it's like seeing the arteries of a river, but then seeing the actual river. That's basically what it is. And you see it and it's red. So I open it with a 1/4 millimeter round burr, and then I disinfect it. And then I bond it with a flowable composite because I don't want to remove too much tooth structure. So, and it's too small, in my opinion, to start putting a bioactive material at the base. And although they come in flowable format, I have not been able to get it in there versus a thinner flowable has been able in that width of a 1/4 millimeter. And so far it's worked. Knock on wood, I haven't done it, but I think on 3 patients only. But so far, no root canals. So
Beautiful.
What else was important to say? We talked about the infection on appliances, which you can't see with naked eye. And what's amazing is being able to show the patient, because they all brag about how clean they keep their appliances. And then you let them look, you know, have their glasses and see when we shine the light through, and they're like, oh, I guess I have to do a better job. Yeah, I think so. So education is very important. And that leads me to back to disinfection. Nowadays, under COVID, in the age of COVID, everybody talks about the UVC lights that we have them in the operatories and everywhere to try and disinfect as much as possible. Now, being able to disinfect something maybe intraorally at the same time as we are looking at it, wouldn't that be amazing? So I believe that that is something that Reveal is heading towards. And I don't want to speak out of term, but I think that would be just an amazing addition to our arsenal to be able to disinfect as we clean and as we work in the intraoral environment. And let's see, what else did I put together here? And the interface between composite porcelain teeth, taking off, I said all those abscesses. Just 2 days ago.
Go back one
Yes.
second. Can I please interrupt you?
Of
I
course.
like this very much, this point you brought in, interface between composites, porcelains, and teeth. Did you, by any chance, manage to monitor partial crowns, ceramic partial crowns, whatever, onlays, inlays, cemented, for a longer period of time. We know all that all these esterase deriving from bacteria and from saliva tend to
marginal
form
leakage.
a delamination and a disintegration of these resins. And I just want to know if you did manage to, if this helped you in monitoring this and identifying these early stages of delamination.
Well, away from a microbiological standpoint, it helped me sell more dentistry, because by showing the patient that their beautiful veneers that were bonded 15, 20 years ago now have a big gap that has bacterial infiltrate all around them, actually will ask them to allow me to either go in and risk damaging the restoration and the tooth by scoring all that out, cleaning it out, microbraiding it out, and refinishing it, or replacing the whatever it is, the crown or the veneers. And yes, absolutely, I think that's a great help for that. It works.
So clearly you couldn't do it early, and now you can.
What's that?
You could not identify it earlier, but now you can.
Right. No, you could. I knew it was there.
Yes.
I knew it was there, and to tell the patient, bacteria can go through there and we can't see it. That's always what we say. There's bacteria, but we can't see that. We can't see viruses. We can't see bacteria. So obviously, if you have a gap as little as it is, stuff's going to get through. But seeing the color change and proving that there is bacteria in there, and mature bacteria, that is, because new bacteria does not, like in new biofilm, you're not going to have the luminescence that you have from mature bacteria, from the porphyrins, correct? I'm asking you, since you're the yes. Scientist here.
Yes, absolutely. We need mature bacteria. Right. Only mature bacteria, which is only mature bacteria is producing porphyrins, and only the porphyrins is what we see. This light back, this orange red light.
Correct. Yes. What I started saying 2 days ago, I had a patient I was doing an exam on, and I took my glasses, and he had one of those gold bridges that he was very proud that this guy, Cisco, did it for him. I said, a dentist? No, with a design on the front. I don't see many of those, but it was canine to canine, with the windows and design on the facial surface. It was quite interesting. So I was trying to look at the margins and everything, and by accident, I mean that almost embarrassed, because when I lifted his lip to look at the margin, I could see an abscess on tooth number 8 at the apex. The tissue had a different color. And then I went back to the x-rays. Did I miss that? Sure enough, I had kind of missed it. It wasn't much. It wasn't a lot of bone loss. It wasn't anything. The PDL was widened at the apex on the tooth, but he didn't have actual radiolucency. But with Reveal, I was able to see actual this change in coloration. It was orange coming through the tissue. And it shocked me. It actually shocked me. So I asked his permission. He agreed with it. He saw it. We cut it open and we got pus out of there. Put him on antibiotics and sent him for endo. So I wouldn't have done that. So what I'm saying is not only making me a better dentist to find things that I would have clearly missed before. I'm embarrassed to say, but I would have. But it allows me, as a person who works for a living, to sell more of my work, and to sell it because it's needed, which is very important, because I don't believe in doing dentistry just because. which we know many people like to do, especially in my preferred field of aesthetic dentistry, when I see many cases that I'm thinking, what, 10 veneers? You could have bleached them. They would have been perfect and added a little composite on the incisal edges. So I like to be very, what's the word? I can't even think of it. I don't like to be very invasive. I want to keep as much of the natural tooth structure as possible. Although I'm a big aesthetic advocate, to me, aesthetics is recreating nature, copying that what God put in our mouth, is not changing it. So that's kind of where I stand on that, but that's a different subject. And then, I thought of the analogy yesterday. I don't know if any of you dive or snorkel, but I remember the first time I dove was in Belize off of Ambridge's Key. And it was a beautiful day. And they told us it was going to be very clear. And I was like, okay. I had gotten certified in a couple of lakes. No big deal. Going underwater and having a visibility of about, I don't want to lie, but about a mile or longer underwater was the most amazing thing. And this was over 30 years ago, and I remember it to this day. It was like seeing New York on a clear day. It was amazing. So that's kind of the same thing with Reveal. Looking at the top of a clear water from the boat and seeing the little fish and coral and whatever you see under there, even the starfish on the sand, and actually getting in and seeing them firsthand up close. That is the difference. That is the difference. And Reveal actually helps me be a better dentist. And truly, that's all what we're searching. We're all in this profession because we want to help people and we want to improve in that what we do. And to be able to improve so well with such a small thing, we use loops anyhow. Especially, I'll speak for myself, getting older and needing glasses, which I never thought I would get to this point, but here I am. And being able to see things even better than in my 20s and understand things and be able to put the science behind that, what I see, and be in a world where we have products that actually treat what we see. And we have modalities where we can actually help people and save teeth and not pull every tooth and have patients at 40 have full dentures because they had a diastema. Or I think it changes the way I practice. Simply that. I don't know. I thought this was supposed to be an interactive, and I feel like I'm just trying.
Yes, but I cannot interrupt you because it simply gives the picture which we hoped. It mirrors the picture which we hoped it would.
And I think you have done a phenomenal job. It changes. I do believe this is the one tool, and it should be, I think, Mr. President, Mr. Richard, I'm speaking to you, it should be advertised as the one tool that changes dentistry. Because I don't think dentists at large understand what a change this can offer them. And it's not just loops, not just the light, it's the whole concept. It's changing. It's putting a microscope in your mouth almost, without having a microscope like an endo. And it's giving you a wider base to go from. And it's not just for one thing, to find the axis and find the canal and find the accessory canals. You can see tissue, you can see bacteria, you can see fungi, you can see everything, restorations, composites, you name it. Well, everything we could do before.
I thank you. And we really had just started when COVID hit.
Right.
But John Walsh really, together with LeaveU, we are really in the process now of, we're beginning to start up again. So thank you. I'm just really appreciate listening. I heard John the other day, his webinar, and I find it fascinating. I really do. And I'm happy from LeaveU, and you're making, it's music to my ears when you see you're happy in your work, and it's allowing you to see more. And
Yeah,
that's my
it's
job,
amazing.
to allow you to do that.
Yes, thank you. And thank you for bringing his idea to fruition, because without that, we wouldn't all be able to enjoy this.
If
And
I may,
so you have your hand in making us all better dentists. Hi,
if I can
John.
jump in for a second. How you doing, Simona? I have a statement to make, because we just had our a WebEx with our new sophomore class coming back from summer break, and they were asking about their ability, or are they at a disadvantage because they weren't able to order their loops prior to COVID, and they, of course, usually have the American Student Dental Association come in and help them with a process where all the vendors come in. And I said, well, maybe it's not necessarily a disadvantage. You may be at an advantage because of the advances in loop technology coming in. And I told them that I would, of course, check with y'all to find out how we can help my students at the university possibly get acquainted with and incorporate the Reveal into their work as they start moving up into the higher ranks in their studies.
I second that. I second that. I think that would be a great time. Introduce them to loops, introduce them to the right loops. Because at least at our school, they ask all students to buy loops. When I went to school, I didn't get loops till 20 years into practicing.
And
So
we didn't have loops in my old age either, so.
we're probably in the same, I'll venture to say, in the same group there.
I would say you're a lot younger than I am.
Right. I'll take that compliment. Thank you.
And to answer your question, John Walsh will handle it. Don't worry. We're here to help the students. If you help the profession, you help yourself. That's
to speaking to a manufacturer, I always say that I still use impression materials that I used in dental school. Whatever we are exposed to in dental school, a lot of it we carry with us for the rest of our career. So I do believe that trying to get on the ground floor with students like John said should be a priority.
Yes.
We believe that, Simona, Dr. Cueves. We really do. We do. We love it. What can I tell you? We really do.
You know, another thing I was just remembering as I was looking, I don't want to go back, but what it helped me for those who do, I like bone recontouring, tissue gingival recontouring. I'm a big believer, and you can't fix the teeth if the gums are ugly and uneven. And I'm amazed to how I see so many beautiful teeth with horrible gums, and I just don't understand why they didn't take the time to do some gum recontouring or even bone surgery. We did a case with a very talented young periodontist here that hopefully will be able to do an article in the near future on. And we used Reveal not only pre-surgery to remove all the debris and the tartar, etc., the calculus, but also the bone level. I could see, and nobody's ever mentioned that before, but you can see a difference in the bone level when the tissue is retracted. So you know when you thin it out, where enough is enough, basically. Because you know, when you go to smooth it out, sometimes I've always had questions before, is like, am I going too deep? Am I not taking enough? And you can make it even across the board by getting the same luminescence back from the bone. And that I found amazing.
John?
Sorry to change the subject, but I wanted to put that in there because I was impressed by it.
It is among the on my list. Okay, on my list it is, especially in once you do your apicoectomy. Okay, one of the biggest problems in apicoectomy is once you open the bone, to identify what is bone and what is tooth. Usually we use methylene blue to dye and to find to make the differences, but using Reveal, you are able to very clearly differentiate between root, so a different structure, as you wonderfully explained,
Yes.
and the bone.
Bone, healthy bone, and I'm sure necrotic bone.
Of course you can, yes.
And necrotic bone, just like dentin.
And we are just at the beginning. We have to understand one very important information. We have to understand that for the moment, we are relying, as you very nicely explained, we are relying on autogenous fluorescence, meaning fluorescence coming from inside. But at a certain stage, we will be able to use fluorophores, meaning exogenous dyes, for different purposes.
Powders or liquids, yeah.
Yes, for different purposes, which will help us even more differentiate and make even better diagnosis. Okay?
Clinical judgments, yes.
It's gonna
amazing.
Yes.
I don't do epicoectomies, but yes.
Yes. As you correctly said, this UVA light at 405 nanometers, it is a pity just to use it only for the theragnosis and not to use it, but for the diagnosis and not to use it for the
afterwards, the treatment, this process.
Yes.
In you know how now in restorative dentistry, that's a battle that we have, and I'm sure all over the world is the same thing, where we're not excavating leather dentin, we're not excavating just stained dentin anymore. And somebody had asked me one time, how do you see, what's the difference in the dentin coloration and the luminosity, the fluorescence of the dentin, and how do you know what's soft, what's leathery, and what's just staining, the difference between affected and infected dentin? And with Reveal, it's very easy. You will get the deepest, when you're close to the pulp and you're dealing with a large cavitation, usually the dentin is brown. So that's what we're worried about. We're not talking about the beige yellow one. We can figure that one out. So being able to know that it still fluoresces at a different color, and knowing that variation by using it, it's hard for me to explain it without showing pictures and without actually somebody seeing it, but you get to know the differentiation in that luminosity, in that fluorescence. So you're able to very easily, when you remove that decay, to know where to stop and how you can save that tooth, and then put a bioactive material, line it, and then do your bonding. Make sure that, like John said in his talk the other day, how important it was to just clean and have the margins perfect, clean. How else can you see if they're clean? Because sometimes the tooth, when we're dealing with restorations like that, you don't have a beautiful tooth all around. Mm-hmm. That tooth doesn't look that great to start off with. So it makes it, with a naked eye, it's very hard to distinguish. Is this, am I far enough? It's so deep. Am I seeing enough? Is it clean enough? Mm-hmm. And Reveal allows you to see that differentiation clearly.
Allow me please to put a question, some questions. Number one, how did this technology, how was it received by your patients? I understand you use a mirror when with the patients. Thank you. So how was it received by your patients? How is it received? How was it received by the dental assisting staff?
First off, the dental assistants were amazed because they were able to see, I was able to explain to them more. So they're able to ooh and ah over it, especially the first time when you use them and they see the green teeth luminescent back, the healthy enamel. It's quite a beautiful artistic palette that opens up. So the assistants liking it and understanding it are a huge support, like with anything else. And I would even venture to say that in the future, if clinics can afford it, to allow their hygienists and assistants to use Reveal, because before, if I'm busy with somebody else, they can actually play around with a patient and start showing them. So prepare them for what's to come, for the bad news that I'm going to give them, which they never like. Patients love it because they feel like they're included not only in the diagnosis, but in the treatment. They can see where we're going with it. My only problem so far, honestly, has been at the school, the older faculty who is not willing to budge off of JV's Black principles and might do it if the whole school implements a certain treatment modality. But you can tell that they're resistant and they're teaching it, but they don't really want to teach it like that. And they don't think they can see it, but my loops are just fine. I'm seeing just fine. Well, try mine. See what you can see. Try. Come on. So almost I feel like at my age, like a little kid pulling at their screw. Come on, please try, please try. So they can see. But I think those that are open-minded, I mean, it's no question. It's no question.
Ask you and John, please, to support us on that, because it is not about sales. Okay.
No,
Really,
and I wouldn't be in it.
really here, and trust me, it is about leaving a legacy.
Absolutely.
And you are already at the bottom, and I kindly have to really beg you both, help us, please. We have to educate, we have to write more, we have to bring this into life, because I can tell you, I had an experience when I went to some place. I don't want to mention exactly where it was, which continent, and I demonstrated the Reveal, and I was asked by a very high educator, why should he be bothered of saving a couple of millimeters of tooth structure? And I apologized for immediately putting down the Reveal and being German and being straight and telling him, imagine you are with a surgeon and you had a broken nail and he is making an amputation of your hand. Yes, this is exactly what someone like yourself and like John, who already use that and who are educators, need to please spread the message.
It's
spreading the message, hands on writing, whatever we need. But this is your support is so much needed. Otherwise, as you correctly know, John, others will say the non-believers who did not bring this to market and because it was not their idea, you know exactly what they say.
And as you know, I listen to them not every time, so it's just that way. The reality is that there are so many different wonderful modalities out there. We have to identify which are going to make that difference in the day-to-day care and management of our patients. and in how we're helping the next generation of dentists and hygienists understand how a device such as the Reveal glasses can make that difference. That you could turn the corner and actually just enhance so many other things that you could be doing with our patients. And the education process, again, when I use it with my students in clinic, they are always amazed at what they didn't see prior. And then as you do, sharing it with the mirror, with the wearing the orange glasses and showing them the residue and the lovely colors that are coming off of the teeth, it just amazes them. And that's on my teeth. No, it's on the guy next door. Kind of thing. And it just, it drives the point home that every patient is responsible. Every person is responsible for their own actions. You're either going to take an action or you're going to regret it in one form or another. And if you determine that you don't want to take the action, then come see me later and I'll put in the implants and give you a wonderful overdenture in that capacity. It'll cost you XYZ times more than it would have been if we'd only just taken care of this early. It's the oil change versus the complete motor overhaul that you're going to need, an engine block situation. And that hits home with a lot of people. They like that analogy, and it really resonates because some of them have had that happen.
Yeah, no, absolutely. I think, and what's very important is to try for us who already use it, to try to get pictures in cases. And for Richard as a manufacturer, I think it's important in order to bring it to the public to put it together with articles that show, be it a veneer case, in my case, surgery, restorative composites, beautiful composites, and how they're done and how much better they're being done because of Reveal. And incorporate Reveal into something, because dentists are very visual. And we are still, although there's so many wonderful publications online, we are still looking at our journals and our magazines that come in, especially the free ones that we always look at. And I'll speak for myself and my friends that have agreed with me. We look at seeing what's bad in them. We don't look to see what's good. And when something's good, we're like, oh, that's impressive. So not allowing mediocre cases to be published together with Reveal, I think that's important. And making sure that every case that you connect Reveal to shows the efficacy of the product, how it improved the treatment, and to actually have really, really good results. Because when I look at manufacturers, for example, on composites, which I'm big into because it's the one thing I feel like I can control aesthetically. Porcelain, I always rely on a lab guy. And this is something I can do and I can put my stamp on it. And I look at cases before and afters that they advertise products with, and I'm like, oh, is this their best? Well, I don't want it. It has to be immaculate. It has to be perfect, or else don't bother. Those are my 2 cents.
Can I add something?
Yes.
Thank you very much, Simona. I am very impressed because you are very excited. I want to try now, but I don't have a Reveal. And one of my colleagues, he just used the loop years ago, and he said, my practice can be now divided into 2, before loop and after loop. And I can see that your life is before Reveal, and then now you see everything. And also I had chance to work with Dr. Nakabayashi. He was also very unhappy with these old people who don't want to accept the changes. And he was always telling me that try to teach the young people. They accept very easy, and they are really very open-minded about the new developments. And we all have to be minimal invasive nowadays. We have to reduce the aerosol, our lives maybe not be as same before pandemic, because we have to reduce the aerosol, and we all have to save to more than before. So I believe that this will work, and people will accept this product, and I really want to try. And thank you very much for introducing it to the world and to us, and we will try and continue, I believe. Thank you, Livy.
And
Thank
we
you,
very
Dr.
highly
Starr.
we very highly value Professor Bellis. Please, once again, for those who did not hear and at the beginning, Professor Sema Belli is the co-founder of the Academy of Adhesive, International Academy of Adhesive Dentistry. She had the academy, she led the academy, she brought the academy to different places in the world. She is, well, you can...
A genius.
Yeah.
A genius.
No, no, I am not the founder, but I try to carry the flag, not the beginner, but I like to carry the adhesive flag.
And adhesion in dentistry changed dentistry.
Yes.
Yeah.
It's the one thing that if you were to look back and see what changed dentistry, that changed dentistry. And I think Reveal will change it probably in the same manner.
Yeah.
Because it allows us to, like I said, cancers. How important is that to be able to see something? I mean, I could go on. And again, these guys aren't paying me. So I truly feel that they're amazing from the bottom of my heart. And that's the reason I agreed to talking about them, because I feel like it's the right thing to do. If we want to help each other to become better as a profession, we can only do it through innovation, and innovation that's applied. Just talking about it and not using it makes absolutely no difference. So we need to get it in the hands of every dentist. And to be able to do that, we have to, John, we need to write some articles. We need to do some stuff and try to show them how good life can be when you can see. See, I'm making a rhyme now.
And tell us more about that. So yes, Dr. Cueves and myself, and probably we hope to have John sometime joining us. We would like to indeed start and provide hands-on courses and more than that.
Absolutely. It's so important.
Yeah.
And it's important to give good direction to dentists, support them in how they do, but also explain to them what the science behind it, and with somebody like you behind it to explain it, we don't need any more.
Thank you. Thank you. Thank you, everyone. Thanks, Simona.
Thank you.
Wonderful. I cannot describe in words how helpful this was. Your knowledge and your experience and sharing all this with us. Really, thank you so much. Thank you for everything. Thank you all for attending. Thomas, John, Richard, and everyone else whom I did not, Gal, Alice, anyone who is here on board. Thank you very much for attending this. I have recorded it, and I will, of course, make it available to everyone. Thank you so much for your time, for sharing. Wishing someone, a part of us, wishing a good night, others a good evening, and please keep in touch as much as possible.
And if I may add, thank you for bringing this platform. Bioluminescence, the group, I think it's amazing. The articles that you share are very enlightening and to the point. And I enjoy being part of it. And John, enjoyed your talk last week immensely. Thank you so much for it. And everybody, it was very nice meeting you. And thank you for allowing me to share my thoughts and my enthusiasm over this great product with you.
Thank you so much. Bye.
Thank you.
Thank you.
Bye.
Thank you.
Thank
Thank you very
Thank
much.
you. Bye.
Bye.
Thank you.
Bye.